Welcome everyone to this week's WHO COVID-19 vaccination delivery, costing, financing, budgeting, and delivery session on costing alone is not enough. Budgets need to be planned and executed. My name is Bruce Struminger, and I'm going to be running through a few logistics before my colleague at WHO, Natalie Van de Meel, will formally introduce and welcome everyone. Just want to remind everyone we have interpretation in French and Spanish available by clicking the interpretation feature at the bottom right of the Zoom toolbar. When you do that, you also, if you want to mute the original audio, can click the mute original audio button and you'll only hear the interpretation. Next slide. We really look forward to your questions and comments about this important topic we're discussing today. Please put those in the Q&A feature, and we'll be monitoring that and hope to get to as many of those as we can. If you have any questions about logistics or the certificate of attendance, please put that in the chat feature, and we'll try to address that as well. Next slide. If you'd like to use the live closing or transcription feature, that also is available, and you can choose the show subtitle under the live transcript option next to the interpretation feature. Next slide. We are recording today's session as we've been recording all the sessions in this series. And your attendance is consent to be recorded. Thank you for that. The recordings in English, French, and Spanish will be made available both on the TechNet 21 website and the website that Project ECHO has to support this initiative, and we'll share links to both of those. We're also offering a certificate of attendance through the University of New Mexico, where Project ECHO is based. We'll share a link to a brief survey, and we really appreciate your feedback about how this series is going, and in particular about how today's session went. And we'll share that about 15 minutes before the end of the session. You'll have 48 hours to complete that and receive your electronic certificate of attendance. Next slide, please. Just a quick note about data use. We take data stewardship very seriously and want to ensure everyone that your personally identifiable data is kept very carefully. We will be sharing it with our partners at WHO. Most of the data, though, is de-identified that's used in various reports and maps and communications. Next slide. With that, I'll hand over the microphone to Natalie for the formal introduction and welcome. Natalie.
Thank you very much, Bruce, and welcome everyone to this session. Before I speak to the agenda, I believe we first have the survey questions at the beginning, if I'm not mistaken. Else I'll go ahead with the announcements. So we have an introduction poll, which helps us understand and identify your involvement in budgeting and your appreciation and understanding and work on budgeting preparation and budget execution. So the first question is, were you involved in any COVID-19 vaccination costing exercise? Meaning, did you support the costing of the plan for COVID-19 vaccination rollouts? And it's a simple either yes or no question. And the second question is it being used, i.e., is the costing exercise of the COVID-19 vaccination rollout plan, is the costing result or are the costing results being used for the 2022 COVID-19 vaccination budget allocation negotiations? Meaning, do you know if you worked on the costing, if that's being used for preparing the budget and negotiating the budget for COVID-19 for the next budget year? And it could be either yes, and no, or maybe you don't know. And the third question is, have you or will you be involved in the preparation or the negotiations of the 2022 COVID-19 vaccination budget? So if it's a calendar year, it's 2022. Maybe it's a fiscal year that doesn't overlap with a calendar year. So it may be 2022, 2023. But have you or will you be involved in the budget preparation for COVID-19 vaccinations of next year? And it's either yes, no, and unlikely, as I am not involved in budget preparation, or I do not know about budget preparation processes. And finally, the fourth question is, do you make any decisions about budget? And it's a simple yes or no answer. And I believe that once the polls is done, we can either see the results immediately, or I believe we see them at the end. And we can continue with the presentation. I guess we can share now the results. Okay, so were you involved in any of the costing exercise? Well, most of you, 62%, were not involved in the costing work of the COVID-19 plan. The second question is, do you know if the costing work and the plan and the costed plan was used for budget negotiation? So a little less than 50% do not know, which is not surprising because very often budget preparation is done not necessarily with the technical units. But 21% said it is being used for budget negotiation, and 32% are saying it's not being used, which is flagging a possible fragmentation between the planning and budgeting, planning and costing, and then the ultimate budgeting of the health sector. Have you or will you be involved in the COVID-19 vaccine preparation? Nicely, I can see almost 50% of you will or were involved. So this session is then particularly relevant, and we very much look forward to hearing your experience. 33% said no or unlikely, and then 21 do not know well about budget preparation. So hopefully this session will then complement this. And do you make any decisions about budgets? Most of you don't. That's what happens. But 27%, almost 30% said yes. So that's very interesting. Again, when we discuss about advocacy a little bit, it would be interesting to hear your inputs. We look forward to this session being an exchange session as much as us sharing with you sharing with you our experience and knowledge. So then let me start with, let's move on immediately to announcements and agenda and learning objectives for today's session. Next slide, please. The key announcement that I want to make for today is really unless I'm supposed to make the next slide, but I don't think so. The key announcement that I want to make for today is that as a follow-up of today's session, which is on budget and therefore on domestic public funding, there will be in 2 weeks another session on mobilizing additional resources in case of gaps. So if public resources are insufficient, how should the gap be funded? And we will try to address this question in 2 weeks on September 1st ECHO session. And if we go to the next slide, you can see that we still have about 12 sessions coming up. Not all of the themes have yet been identified. Some will be on country learnings and they're in preparation. So we'll soon advertise with you what the contents of the discussions will be. And towards the end of the year, we have other sessions that touch upon health systems aspects, such as maintaining essential health services and addressing bottlenecks in health workforce. Next slide, please. So today's agenda are among three presenters. The first, Peter Cowley, will discuss why costing and budget cycles matter. I will then cover the importance of budgeting for COVID-19 vaccination rollout. Why is it important? What are the lessons learned? And what can we do? How can we impact the budgeting? And finally, Hélène Barrois will discuss making certain budgets reach vaccinators. And it's understanding PFM. PFM stands for Public Finance Management. And it's understanding how countries' public finance management mechanisms have an impact on the budgets reaching and being executed and reaching the vaccinators, which is key to us being able to successfully implement our program. Next slide, please. So today's call is to generate awareness and understanding around the importance of budgeting process and budget execution. I think from the poll, we identify that budget is a bigger area than solely our expert area. Many stakeholders and decision makers especially are involved in budget preparation. But it's important to understand what the process is, what the timing is, and especially understanding also budget execution, so that by being aware, we can see how it's important for us to successfully implement our program and where we can possibly intervene, influence, have an impact, and what sort of impact we can have. So the learning objectives is learning about the process of preparing and executing a budget, understanding where and how we can influence the budget preparation, and understanding what impacts the good execution of a budget. Next slide, please. I believe I'm passing it on to Peter Cowley, who will discuss why costing and budget cycles matter. Thank you.
Thank you very much, Nath. Can move on to the next slide, please. This is a fairly dramatic slide, and I'll go through what this actually means. The economic decline from COVID-19 has been dramatic. We've seen losses on GDP of over 20% in some countries. You'll see from this graph, economic cycles change over years. And the 2008 subprime mortgage crisis, you'll see the decline, especially in upper middle income and higher income countries. But this was nothing compared to the decline associated with COVID-19 and the drastic reduction in economic activity. And it has affected virtually every country. The sharp-eyed ones of you will notice that it's affected the higher income countries a bit more than lower income countries. And there's a reason for that. And that is the proportion of their economies that were service-based. It was higher. And a lot of the service-based industries were particularly hard hit. The reason why I mention this and start with this very negative slide is it puts revenue into context, because government revenue depends on economic activity. And in recent, government revenue has even fallen more than economic output. So this is the slide of government revenue, general government revenue growth. The slide on economic growth is not as bad as this one. So not only are governments hamstrung by a reduction in economic activity, but their government revenue has declined even further than this reduction in economic activity. Next slide, please. We're also going to see the government expenditures are going to flatline in many countries. And I'll get to the reason why I mentioned all of this and start with these fairly negative pictures in just a moment. You'll see during the great lockdown of 2020, 2021, and hopefully not much longer, there's been a massive increase in government expenditures. This is due to, we call expenditure shock. And this is due to a lot of the associated expenditures and social safety nets, keeping businesses open, keeping credit lines open. Some have gone into health. The government expenditures, in particularly higher income countries, has shot up. Yet government revenue has, in the previous slide, has gone down. So this is what has resulted in what are called deficit spending. And this deficit spending basically means you spend more than what you bring in. And that deficit spending in many countries has doubled. And this has to be paid for either through reserves or paid through by debt. And on to the next slide, please. Debt. As you can see from 2020, debt loads have gone up dramatically. This is a picture from the Western Pacific Regional Office where I happen to work. And these are countries in East Asia and the Pacific, and some countries in Southeast Asia. What this slide is showing is that there's a rising increase in debt load relative to government health expenditures. So when it's above 1, governments are spending more on debt servicing, that means debt repayments, than they are on health. And many countries were already going into the COVID epidemic, spending more on debt servicing than they were on health. And many more countries are going to be in that particular situation. We're going to be moving into that situation, spending more on debt servicing than they do on health. And those that are already in that position are going to worsen. Because of what I had mentioned earlier, the government revenue has gone down and government expenditures have gone up. And this balance needs to be paid for either through reserves or through debt. Next slide, please. Why am I mentioning all of this? It's very, very, very important because ministries of finance are in a very fiscally conservative position right now. They are looking for every dollar, peso, franc, whatever it may be. They are looking like we have this expression, looking like a hawk, like a bird of prey, in the sense that they are going to be examining every expenditure. They're going to be very conservative. And even COVID-19 vaccination, as unbelievable as it may sound, will be up for discussion, funding for COVID-19 vaccination. You would think that the economic return associated with that and the lives saved is a no-brainer in terms of funding. You cannot assume, because of the fiscally conservative position that governments are currently in. Fiscal space is not optimal for health. As I mentioned before, the differences between revenue and expenditure. What this actually means is that this means that governments are going to be, in particular ministries of finance, are going to be looking for properly costed activities in terms of budget submissions. This applies across all sectors, but particularly in health. Government ministries of finance will also be looking at what is going to be the financial obligation beyond this year. And you'll often hear terms of medium-term expenditure, medium-term budget frameworks and analysis. What this basically means is that you cannot, the ministries of finance want to see over a 3-year horizon. So it's not about just submitting the COVID-19 vaccination costs for this year, but what are they going to be for the next 2 or 3 years? Because government is in a very fiscally conservative position in most countries. What else is government looking for? Rather, ministries of finance looking for? They're looking for is money going to the right group, the right sector in terms of COVID-19 vaccination. For instance, sometimes some COVID-19 vaccination monies would be better distributed to Ministry of Education or Ministry of Social Affairs rather than to the Ministry of Health, or even to the military or to other sectors. So finance is looking for not only that activities are well costed, and that they also reflect a medium-term plan, they reflect a multiple-year horizon, And they're also looking for our money's going to the most appropriate sector, or the most appropriate budget holder. Of critical importance, very, very, very important, is that, and my colleague Helene Baroy will speak a little bit about this in a moment, is that governments are trying to get money, in particular ministries of finance, are trying to get money to frontline health workers for COVID-19 vaccination. We all know that this is a struggle in many countries. The public financial management, quote unquote, shortcuts, which allow for this to happen in a rapid way to ensure good budget execution is something that finance will look to make sure that that the budgets that they distribute to sectors is actually well monitored and well accounted for. So it's a bit of a balancing act in that finance is trying to give the flexibility to sectors to enable fast movement of money, for example, in case we're discussing to vaccinators, but at the same time, they will demand that these funding due to these fast track procedures are well monitored for and well accounted for. It does not give you a free pass in terms of proper monitoring and accounting of Ministry of Finance distributed funds. My colleagues, Nathalie and Helene, will discuss more in depth the various components, but I wanted to give you of this slide, but I wanted to give you some context as to why finance is in particularly a conservative position, and in particular, why we as health, and in particular the COVID-19 vaccination community, need to make certain to cost out things properly, to make sure that budgets go to the proper budget holders, and of critical importance, to make certain that budgets are properly accounted for and that they are well executed. They are well executed, I repeat this for its importance. Many countries and many sectors leave money on the table at the end of the fiscal year because of poor budget execution. Nothing will put finance in a more negative mood than poor budget execution. And next year, when asking finance for funding for COVID-19 vaccination will be difficult if all the funds haven't been utilized properly this year. Over to myself, apparently, for questions and answers, and I'll just look in to see what we have here, see if we have any. If not, I will pass on to greetings to everyone. Seems to be quite a active. I don't see any particular questions. I will wait for just a second to see if anyone has any questions they could post on the messages. If not, I will hand over to my colleague, Natalie.
Peter, I forgot to introduce you. If there are no questions, even clarification questions that you would want to put in the chat, Peter, maybe you want to introduce yourself. I forgot to do it.
It's my name's Peter Cowley. I'm a health finance and service delivery expert, and I work in the Western Pacific Regional Office part-time and also work at headquarters part-time.
Thank you, Peter. Thank you for that. There are no open questions. I know that some of the audience had a difficult time to hear you properly, so I was hoping there might have been clarification questions, but when other questions come, Peter, don't hesitate to, what are the implications of the global level of COVID-19 vaccine financing? I'm not sure what you mean exactly, but what are the implications at the global level for COVID-19 vaccine financing? And that might be a question for next session. I'm not sure I understand exactly well the question. Peter, I don't know if you have an answer for this one. Maybe you can type the answer.
Similar in the sense that funding is short for everyone. Less so for higher income countries because they have the reserves and the ability to access debt. more readily than lower income countries. And remembering the global community is made up of contributions from countries. So there was some fear earlier on in the epidemic that they would see some reductions in contributions to bodies such as Gavi, Global Fund, the World Health Organization, et cetera. Mercifully, this has proven not to be true. But the economic crisis affects everyone and affects every country. The ability to deal with that crisis differs, and it's very country specific. That probably is not the most direct answer, but it was a big lack of clarity on the question, and certainly can address it, provide a bit more clarity. Over.
Thank you, Peter. I think we can move on to the next part of this session about the importance of budgeting well and the implication of budgeting for COVID-19 vaccination rollout. And if we move on to the next slide, what we noticed is that last year, when we were preparing for this year's budget, be it a calendar year or a fiscal year, we did not anticipate that there would be vaccines. So very often last year, we did not include any budget for this year's vaccine rollouts. And we will see what repercussion this had. And in order to understand why there were no budgets for COVID-19, and then how did we manage to find resources this year for vaccinating against COVID-19, is explained by the blue chart below. That kind of gives it's a standard timeline proposed here, which probably fluctuates from one country to another. But it's important to understand the steps and the timeline of preparing a budget for the following fiscal year. And you can see that preparing a budget first starts with understanding what is the context and the anticipated context. So we anticipate that there would be a macroeconomic and revenue forecast that will help tell us whether we're likely to have more revenues and therefore ability to spend, or less revenue, any economic downturn that may mean that we need to shrink our budgets. With that information, then each ministry then prepare a budget proposal. And this is where our technical expertise of developing a plan and costing a plan comes in to contribute to the Ministry of Health preparing a budget. Once each of the ministry or all ministries have prepared their budget, then we enter into negotiations. And ideally, this is where we want to see involved the civil society, national dialogue, coalitions, to advocate and have an impact and an influence on the final budget, and what are the policies that we want the government to support with financial resources. Once the budget is negotiated, it is transformed into a finance law that is submitted to the Parliament for review and approval. And you will see again, depending from one country to another, there are variations in the way the budget is being prepared and processed. Some countries will still allow a lot of negotiations and adjustments to the budget during the Parliament time. Other countries kind of cook the budget before it reaches Parliament. And we know that at Parliament and during parliamentarian discussions, the budget doesn't change a lot. So it's important for us to really understand this process and this timing, to be able to see when we need to contribute, what we need to contribute. Finally, in December, the budget is adopted, ideally by the Parliament. Once the budget is prepared, then what Peter mentioned in his slide is discussing budget execution, which Hélène is going to discuss as well. So let's say in 2020, we prepare the budget for 2021. In 2021, we execute the budget, which is just as important a step, because we will see that there are risks of bottlenecks. And then in 2022, we then monitor and track expenditures and audit expenditures, because it flags whether the expenditures were aligned with the proposed policies that the government wanted to implement. So that is the standard flow or steps of preparing a budget. And as you can see, planning and costing really goes into supporting the budget proposal preparation by the Ministry of Health. And if we move on to the next slide, It's an example taken from a recent Reuters article of Botswana and how Botswana had budgeted for COVID-19, but then there was a gap based on a third wave of infections being coming to the country, and the Ministry of Health identifying a gap of $100 million. And the resources originally allocated were depleted already in July. And therefore, the Ministry of Health asked that the Ministry of Finance advocate at the Parliament for a supplementary budget. So this helps explain how sometimes you don't budget, but then how do we do, as we did for COVID-19 this year? We didn't budget. And how do we do to suddenly find new resources for a supplementary budget? And supplementary budget may come from additional revenue that could have been raised the previous year or at the beginning of this year. But very often it means that we reprogrammed money and budgets away from interventions and actions that were not as urgent as probably interventions and the response, for example, of the to the COVID-19. So if we move on to the next slide, we identified the budget cycle and how sometimes you need an additional step of supplementary budget. But now for this year, why is it important to properly budget? And what happened this year when we didn't budget for COVID-19, or we hadn't budgeted for COVID-19? How did countries do to pay for the vaccination? And from the information that we were able to collect, we identified 4 types of approaches to fund COVID-19 vaccination. As mentioned, there were funding that were reprogrammed away from different sectors, but especially from the health sector and within the health sector from essential health services. And I'll say why this has an impact and why it's important to understand this particular impact. Other countries decided to increase taxes, but not so many. Other countries decided to take out loans, which, as Peter explained, the debt burden has an impact on your budget because some countries have a debt burden or debt servicing burden, which represents a large share of the budget. And if you keep increasing your loans and your debt servicing, it has an impact on your future budget to implement policies. And finally, some countries also imposed fee for service. So we saw that in India and Egypt, where some households had to pay for being vaccinated. Before we move on to the next slide, I want to go back to the issue of reprogramming funding away from essential services, because it basically means that in order to prevent or to care for COVID-19, then we basically displace money from even being able to prevent or care for other diseases. And so what we want to keep in mind is while we advocate for budget for COVID-19, we really want to advocate for it in addition to the existing health sector budgets. Next slide, please. So we understand now why it's important to budget because of the repercussion that it has. Now, when do we need to engage in budget planning? And I started flagging it in my previous slide. The 2021 budget really needed to allocate suddenly available funding to both COVID and the broader health sector goals. So when we discuss and want to engage with the budget planning, we need to understand the participatory aspect of budget planning. And so ourselves as technical experts in vaccine rollout, we want to communicate and engage with the colleagues in the Ministry of Health as they prepare and submit their health budget allocation proposal to the Ministry of Finance, so that we give them the tools and the evidence and the information for the Ministry of Health negotiation with the Ministry of Finance. Because the Ministry of Finance needs to understand that COVID-19 vaccination is unprecedented. In some countries, it may represent 3 or 4 times the usual immunization budgets. While maintaining essential health services budgets. So we find out when budget preparation typically takes place. It's important for you to try to identify when is the budget preparation starting and when is the window of opportunity for you to engage with that preparation. And we would do that by contributing inputs needed for the negotiation between the Ministry of Finance and the Ministry of Health. The timing is also very important because as we will need to go and advocate for a bigger health budget in order to, again, I repeat, maintaining essential health services while finding resources for COVID-19, we need to be able to make sure that we bring in our plan and our cost when the Ministry of Health is preparing its budget so that we can try to integrate where feasible. We don't want to come in with just a vertical budget that is prepared independently of the rest of the health system, because we are dependent on the health system. And we see that, for example, we have colleagues from other programs like the non-communicable disease programs that are interested in some of the information that we need to collect for COVID-19. For example, for COVID-19, when we are about to vaccinate or when we decide who should be vaccinated first, we identify vulnerable population. And those include population, for example, with diabetes or with cardiac conditions or other non-communicable conditions. And this information would be relevant to non-communicable diseases program. So this is an example of how by merging efforts and collaborating within the health sector, we can actually then go to the Ministry of Finance, also advocating for the efficient budget preparation that we developed. So in terms of when, I wanted to ask you, and I'm not asking for you to answer, but to answer to yourself, do you know your fiscal year? Is it aligned with the calendar year or not? And do you know when your country budgetary calendar starts? Do you know when you would anticipate to engage with the preparation of your budget in your country? Next slide, please. So then next is, what can we do? One, we want to identify and understand COVID-19 budget provisions. And I will give you an example of this so that you understand what are the budget holders and what this means. Why is it important? And Hélène will also go back to this issue of budget holders. So if we go to the next slide, please, yes. This is an example. The next slide is an example that I've taken from an online extract of the Uganda approved national budget. And you can see this is an Excel file, and I filtered for the outputs that were about immunizations. Already you can see that in Uganda, you have three different outputs related to immunization. So already my budget is organized, and I don't just have immunization output, I have 3 different immunization outputs. And these immunization outputs are then attached to different programs, which are the national hospitals. We have regional hospitals that don't appear on this slide. We also have pharmaceutical and medical supplies, or pharmaceutical and other supplies, public health services. So these different programs have as output different immunization services. And in order to execute and to deliver on their immunization output, then they have different line items, which you can see on the right. On the right, you can see that you have line items for travel, for medical supplies, staff training, staff salaries, and so on. So it's important for us to understand, well, my budget for COVID-19 is not simply, here's my budget, here's my plan and my cost, and give me the budget, and I have full control of the budget. I will need to rely on various programs and budget holders to execute my budget. And this is important information to keep in mind, and you will understand when Hélène presents in the next slides. If we go to the next slide, please. Then after identifying and understanding, then the number 2, if you can click number 2, yes. And once we have that, and we have our costing and our plan and our costed plan, we want to prepare a good narrative using the evidence that we have. And this helps us argue for maintaining health budget while vaccinating against COVID-19. So we need a sound costed plan with evidence of efforts of savings, efficiency, postponement of non-essential activities and investments, where it shows that we've collectively and integrated what the health sector needs to address for next year. And if we go to number 3, then what we need to do is to be loud and persistent in our demands, and to be technically well prepared. The issue, as Peter highlighted, working with other sectors as well. So it is very important to be well prepared, to have evidence, and to advocate repeatedly to make sure that our point comes across. So then if we go to my next slides, which are really a recap, what can we do? How can immunization colleagues engage? So it's us. How can we engage? One, we need to understand the context. And earlier I said, we need to understand what is the macroeconomic. Am I speaking to the Ministry of Health and Ministry of Finance with the knowledge that revenue will increase, or with the knowledge that revenue will decline? Because then my asks will be different. And if we go to the next slide, I wanted to give you an example of the COVID-19 global COVID-19 vaccination strategy that was presented. And we identified different scenarios, for example, vaccinating only 50 years old population and above with no booster, all the way to vaccinating everyone with a booster dose. And these different scenarios have different cost level, obviously. So then what we wanted to see is what are potential health system and financial challenges that may limit me in being able to successfully implement one of the scenarios. And to do this, we looked at the costs as a proportion of what is the anticipated general government expenditure. Because if my cost of vaccinating against COVID is over 1% of general government expenditure, it is likely to be challenged by the ability to execute the resources and to have a system that helps me execute and spend and use the resources budgeted. We also looked at other health system limitations. For example, our health workforce colleagues in WHO computed how many health workforce were needed for each of the scenarios. And they looked at, of these needed health workforce, how many could be taken from the existing health workforce and how many needed to be additional to existing health workforce. And when the additional health workforce exceeded the existing health workforce by more than 10%, then we flagged it as a risk that the health system may not be able to support the proposed vaccination strategy. And finally, also as a health system potential challenge, we looked at countries that were not yet able to reach DTP3 coverage of 60% and above. And our hypothesis is that if we are not able to reach 60% DTP3 coverage, then there's a likely challenge with the immunization system in place to then suddenly take on an unprecedented level of vaccination for COVID-19. Next, please. So one, understand the context. Two, plan and costs. Some of you didn't work on the cost, but I think you know about the NDVP and the CIVIC or other tools that are about planning COVID-19 vaccination and costing it. And number three is what I explained before. We need to understand the budget structure. This was the Uganda example. And number four is my last point. We need to advocate. As I said, we need to come prepared with the narrative evidence. And some of the arguments for which there are references that are published that we can use is that the economy will really not be able to open or restart safely and sustainably unless the epidemic is controlled. COVID-19 vaccination also saves lives and reduces morbidity. And finally, international trade is dependent on global vaccination against COVID-19. These are some of the arguments that will speak to the Ministry of Health when we want to advocate for our larger health budgets. And this is last slide. I think I'm moving on to the questions. I'm worried that we are a bit short of time. So let me look at them. Some are answered. Okay, very well. What are the implications? Oh, I see Peter's answering one. Are there examples of the usual budget for routine immunization being redirected? There are examples. It's being monitored. I don't have them available here, but we can share. There are surveys that are being conducted to understand the impact of reallocating, be it financial resources or HR resources, to other services and having an impact on routine immunization or other health services. Unfortunately, I cannot give you one now, but we can follow up afterwards. How can scenario-based costing of COVID-19 vaccination rollout be captured in a country's budget? as the cost for each scenario is likely to be different. Yes, I think the scenario-based costing is evidence, and then at some point the scenario needs to be decided, and pick one of the scenario for the final country's budgets. Budget overlaps mean that provisions of last budget move to the next budget cycle as a result of non-implementation. Okay, I don't think that's a question. All right. This is it. Hélène, I will let you introduce yourself and move on to your slides. Thank you.
Okay, thank you, Nathalie, and good morning, good afternoon, everyone. So my name is Hélène Barrois. I'm a senior public finance expert in the World Health Organization. I'm part of the health financing team. So I've been asked to do my part in French to diversify the languages in which we deliver the webinar sessions. So I'll switch to French and I'll let you connect to the interpretation if you need to. Next slide, please. Donc, Nathalie.
Therefore, Nathalie showed us, gave us a good review on the for budgetization. Now we're going to see together that it's not enough, and Nathalie said it's not enough to have a well-prepared budget. An approved budget is not enough. We can see that during the implementation phase of the budget and the execution of the budget, it can be a few bottlenecks, a few delays, some complexities, and that will prevent and for especially the delivery of vaccination. So in this part of our session, we will focus on the implementation and the execution of budget, and to try to understand better together what are the different bottlenecks in this budget cycle. And within the context of COVID-19 vaccination, some countries had to adjust the modalities of budget management the COVID-19 vaccination. Next slide. So I want to remind you that actually the issues that you can find during the execution phase of the budget is that in the health sector, we often face budgets service between 2008 and 2016, a rather long period. And I show you here the 16 countries which are not very performing. In average, for the health service, they will execute less than 85% of the allocated budget. So it's a comparison between the approved budget and that they've been and Gabon. So something we can observe as well in the health service, that health service budgets seem to be systematically less well than budgets of other sectors. And if you can see on the right-hand side in red that in the same 15 countries that we analyzed before, the level of execution for health is systematically lower than the level of another sector like education sector. So the health sector is not very well executed, has a lower execution You must understand that this under-execution of budget within the health sector comes from a multitude of factors, and I want to highlight that these reasons are because they are problems because of the budget management. So there are issues of budget management in all the sectors, and it comes from the government. That's one package of reasons, and I put it in this slide about the general causes, the generic PFM causes, and we can see in some works that we are implementing at the moment that there are a lot of reasons which are very specific to the health sector. And if we put together these two packages of reasons, you understand better why systematically the health budgets are under-executed. And to give you some example, to be a bit more concrete, I am going to give an example of the generic cause and one of the health-specific cause. One generic cause would be what Natalie has already mentioned, in particular, the fact that some budgets are presented rather rigidly. They are very rigid. You know, they present it by lines which are very, very detailed. And afterwards, the Ministry of Health is restricted to execute these lines and has no possibility to readjust. And that's a factor that can contribute to reduce the level of execution. Now, another example for the health-specific cause would be in the health sector, often there is a multitude of flows of sources of funding. So domestically speaking, and you have other exterior sources, and each flow is linked to a protocol of execution of spending, which is very specific and very particular. And because there are such different protocols and which are not necessarily identical, all this can contribute to reduce the level of execution of the budget. So you can be lost in all these budgeting lines, and it causes a lot of difficulties. So this is to summarize the key message that you want to provide, that there is a poor health budget execution. And it's not only linked to absorption or capacity from the Ministry of Health, but it's linked as well to a lot of factors. And some of these factors are outside the health sector. They are linked about the way the Ministry of Finance manage budget. For the specific case of vaccination or COVID-19 vaccination, we worked on analysis in order to spot some bottlenecks, some issues linked specifically to this execution phase of the budget. We tried to spot by categories, which are indicated here. What was the problem? What was delaying? What was hindering the good execution of the vaccinations? I will take a couple of examples here. Well, I think you can see here the link. You can have the link. I can provide this later for you. First of all, that we spotted, and this all the time coming together back again and again, there are procedures to authorize to dispose of the funds. The budget has been approved, but there are next stages which are necessary to really have this available funding for vaccination. And this has delayed the spending linked to vaccination. Second issue, which is often found in countries, it's linked to the existing regulation for contracting vaccinators. Often, the frameworks of public funding and the recruiting are very, very rigid. And this is a factor which delayed a lot, who made it very difficult for implementation of vaccination plans. Third point would be lack of access for vaccinators or for supporting staff to support this vaccination. For this specific personnel, not enough funding to buy equipment or items which are not necessarily vaccination, but small equipment that are very, very important as well for the good implementation of vaccination. So if the funding is not directly given or is not available for this specific spending for the staff of frontline, this is definitely a bottleneck for the management of the spending. Next slide, please. Next slide. In this context of bottleneck linked to the spending management, we found out that a number of countries were able to manage these bottlenecks, and we are going to see them together. 3 examples. Let's see what was done, and it's quite interesting as good practices in this specific context. First example is linked to the setting up of accelerated modalities of authorization of the spending. So in some countries, you have 5, 6, 7 stages between the time when the budget has been approved by the parliament, for example, as Nathalie said, and the time when actually, as vaccinators, as staff, they are able to have this necessary funding to do their work properly. So there are 6 or 7 stages. It's really delayed. So some countries, for example, India, Ukraine, and other countries have adopted a fast-track spending authorization. They have simplified this stage in order to accelerate the spending. They have facilitated the spending. They have liberated the spending so that the vaccination can be properly done. Buying vaccination, paying the staff who are vaccinating people, and buying small equipment for vaccination. That's been really, really good. It's quite interesting for you, I think. Next slide, please. Second example I want to provide for you is actually, this example is linked to the issue I just talked about, which would be to make the fund available for the frontline for frontline staff for vaccination. There are upper levels of district, for example, access to funds. It's very important, but staff who are in the health facilities or vaccination sites, because of certain procedures in the management of budget, do not have access to funding, which are necessary to implement the vaccination plans. So in Philippines, for example, they decided to have advance payments or prospective payments. So they made advance payments towards the agency called PhilHealth, which is an insurance agent. But this insurance company afterwards disbursed very liberated funds very rapidly to more than 700 health facilities so that the work can be done very, very fast. Normally, it would be refunded afterwards, but they decided to anticipate and to advance payments. And that was very, very positive. That was really, really important in order to facilitate the response to COVID and as well to the vaccination plans. Next slide. The last example I would like to give to you is related to the issues of contracting. The care providers contracting people for temporary staff, which is very necessary for vaccination, of course. So we know that often the frameworks and regulation from public finance provide or contain very rigid elements. So it doesn't really help. It's not easy to recruit temporary personnel. If we take the example of Estonia or other OECD countries, we find that there's been some adjustments which were very rapidly made on these specific frameworks in order to allow more flexible recruitment of temporary staff for vaccination. So, of course, you don't speak Estonian. Sorry about that. But on the right, you can see an example of a contract in Estonian. It's a contract which was quickly drafted, quickly made in order to allow recruitment of new temporary staff for vaccination. Next slide. Of course, it's very clear that the various modalities that I've just introduced for you, which give more flexibility for spending management for the sake of vaccination, can only happen, as Peter said, can only happen with an accountability. It's very, very important. Therefore, what are the key takeaways to complement what Natalie and Peter already said? First of all, we know that, of course, the level of funding to the response is very important. But as well, it's the way that these resources will be channeled, will be dispersed within the system is very important, is as important as the level of resources. All these modalities will have a direct impact on the implementation on the vaccination plan. We saw a number of bottlenecks, systemic bottlenecks impacting vaccination. So many countries had to adjust their own modalities of spending management, especially the modality of spending once the budget is approved in order to have more flexibility for the sake of vaccination. And to finish, one question which is for all of you, we have a question in our work to see whether a number of these modalities which were introduced during the COVID crisis and for vaccination could be maybe maintained and sustained on the long-term basis, because we can see an interest for the specific modalities for a spending that can really help the health sector to accelerate, to focus more, to target more the issues, and to sustain more against the response, against the crisis, and for a better response to COVID. So to finish, I can just quote two key references here, and I really encourage you to have a look at this. On the left, it's about a note where it summarizes why and how PFM is important for the effective rollout of COVID-19 vaccines. And on the right, this document, I hope you can see the links, will detail the various considerations linked to the spending management for the COVID-19 vaccine rollout. And many countries are quoted in this document in order to tackle the challenges. Thank you very much.
Thank you, Hélène. It's now your Q&A time. I see there is one question for you on corruption, another one on costing. There is one question on costing, which I think maybe if Raymond is still online, could help answer. Or Karine, I see Karine is online, and Raymond. So if you could help answer the one before. There's one on corruption, saying corruption is one of the serious issues in healthcare, which might increase with an expedited allocation. Any advice? That's a large question, good question, and large question. And then while you answer this one, for planning purpose, let me read the other ones in case.
Just quickly on the corruption question, maybe. So indeed, we've seen some stories or news stories about corruption, misuse of funds, higher price than what was reasonable, also in the context of the purchasing of equipment, goods and services for the response to COVID. This was the case in South Africa, a little bit in Uganda and Kenya as well, and possibly in other countries. One message that I think we think that providing more flexibility in the use of the resources is one thing that can really facilitate the response and the vaccination and the vaccine rollout. And we want to distinguish this provision of higher flexibility from misuse of funds, corruption, because we do think, and we've observed that in countries, that corruption and misuse of funds is not necessarily associated with how actually the system is designed. It's more a personal responsibility, is not necessarily linked to flaws or to specific aspects in the design of the PFM system. So we don't want that these stories that we receive on corruption actually impact negatively the flexibility message that we want to convey. But for sure, corruption needs to be addressed seriously. And of course, accountability systems need to be strengthened, and a good reporting of expenditure related to vaccination is a requirement.
Hélène, there is one more question. They thank you for the great presentation. Please, could the challenge in budget execution in the health sector be due to other factors in addition to COVID-19? What was the situation before COVID-19? So I think maybe you want to clarify that.
Yeah, so as I explained with the data that I shared, as that in the health sector, budgets are systematically under executed for a myriad of factors that pertain to the health sector itself, but also factors that are more broadly associated with how the PFM system works in practice. Lots of rigidities and complex modalities that delay the spending and then at the end contribute to reduce or decline or affect the level of execution or the level of spending. Now with COVID, we don't have the data yet, but what we are monitoring is to see whether actually the crisis has introduced some inflections or some changes in the rules and the practices in relation to budget execution. It might be that in some countries, the crisis has actually contributed to accelerate the spending, so to improve the level of budget execution. So it's something that we are monitoring, and that would be very interesting probably also to assess in your own setting. But it might be that there is something indeed to be learned from the crisis, some new modalities, as I said, that were introduced during the crisis that could actually help us to improve the level of execution in the sector, even beyond or after COVID. Okay.
Thank you. And then I think there's another question on 1%, but we're running out of time, which was addressed to my presentation. And Peter is helping answer that one. Great, thank you. Shouldn't health financing procedures adapted to health crisis responses be integrated?
Natalie, if I could just comment on the 1% and also just on the corruption, just very quickly. You know, these expedited procedures, which Elaine had mentioned, are given normally on a temporary basis. So they're given and they can be taken away. And what corruption does, especially in an expedited budget process, is that it spoils it for later years. Once finance sees the Ministry of Health, for example, would misuse, there were corrupt practices with these expedited budget execution procedures, it will not be in the mood to extend these for many years subsequent, because it will remember that it had given Ministry of Health a chance for a good reason for these expedited procedures. So not only is it a corrupt practice, but it spoils the environment, the PFM flexible environment for years to come. And that is of great detriment to attaining UHC. The second question on the 1% figure, this is something that is, you can see in the literature, 0.5% up to 2%. It is a recognized figure with ourselves and the bank and other colleagues. It can change, but it is a figure in which we are currently working with. That is based on some of the cost estimates that we're getting from many countries with use of the civic tool and other costing methodologies. Over.
Thank you very much, Peter. I think, unfortunately, we're going to need to take on the answers for the other questions in the chat, Hélène. So I believe there's one more for you that you may want to answer. And I also want to see that in the chat, my WHO colleague from the Egypt office corrected what I was saying about households paying for being vaccinated. This was information I found a few months ago, so probably didn't get implemented. So thank you for correcting this. And I would like now that we move on to the surveys, the poll at the end of this meeting. So the feedback poll, the first questions to you is, are you aware of any existing PFM bottlenecks? So this is what Hélène just explained. She reviewed the different public finance management bottlenecks that may impede proper execution of the program. And we wanted to know if you knew of any that, and to provide an example, or if you you were not aware, probably because you haven't accessed the information. So I will let you answer that first question. And the second question is, do you know where the COVID-19 vaccination budget will sit in 2022? So do you know if most of the COVID vaccination budget will be under the Ministry of Health, or will it still be possibly under the emergency funds, Ministry of Finance, President's Office as an emergency package, or maybe under another ministry, or that you don't know? And I am asking my ECHO colleagues, as soon as we have the majority of answers, to do not hesitate to show the answers. Thank you. Can we review that? Okay. Are you aware of an existing PFM bottlenecks issue? It's about 50-50, so that's very interesting. Good. I assume that the inputs or examples might be provided on the side as feedback to us. And then, do you know where the budget will be sitting? So 30% Ministry of Health and 25% still with presidents or MOF or emergency funds. But still about 40% of you don't know where it will sit. This is very interesting to understand how much integration there will be with the Ministry of Health budget or not for next year. So thank you very much for this. We're running a little bit late. So first I want to thank you for attending this ECHO session. At the end of the survey, you should be able to print certificates for attendance or just submit your feedback. I hope you saw that. We really value your feedback for improving these learning sessions. So please do take advantage of the attendance certificate and to provide any inputs you want to share with us about these sessions. And you should receive an email with the link to the certificate. So with that, I want to close this session. I would like to thank you very much for joining this very complex seminar and for your questions and inputs. We would like to hear of any lessons learned or your experience. So if there's any way you can share after the seminar with us through emails, we would be very interested in exchanging with you. We would like to thank the ECHO organizer as well for helping host and put up this webinar very effectively. So thank you very much to the team. And then last but not least, of course, thank you very much to the translators who accepted to go both ways, English to French and Spanish, as well as French to Spanish and English. So thank you very much to both of you. And thank you, Hélène and Peter, of course, for accepting to share your experience and knowledge with this group and with us, and for taking the time to present this seminar. Thank you, everyone. Unless I need to bring anything else, but
bye. Thank you.
Goodbye, everyone. Yes, I needed to share the webinar materials. Here are some materials in case you want to ask questions and share your experience.
Bye.
Thank you. Goodbye, everyone.